So around the age of 50, late 40s, we expect that women's periods will end. Culturally, we understand that concept. What we don't understand is perimenopause.
And what are these symptoms that you're talking about, like in the perimenopausal?
1 in 4 women won't have any symptoms. Women who exercise, these 40 and 50-year-olds that have been exercising for years, their symptoms are a lot less.
We get to open up a little bit. Some of the women are not aware, who are in their early 30s, mid 30s, late 30s. They're not aware of the word perimenopause. Welcome to BeHuman Podcast. This is Saif Al-Yasi. Today my guest is Dr. Tamara MBBS. She is a family medicine here in Dubai, and she specializes in perimenopause and menopause. The talk of today is going to help you as a woman and you as a man. So if you're interested to know how to handle the woman as a man and how women should be knowing their body and their hormones, you have to listen to this podcast and listen to the topics about the perimenopause, when it happens, what is menopause, hormonal stress, the hormonal imbalances, which Dr. Tamara hates to say. There are so many topics that we are going to cover today, so stay tuned and listen carefully and take notes. Join me and don't forget to subscribe and like and share so we can continue doing this for a very long time to help health in human beings and help become humans again. Welcome, Dr. Tamara.
Thank you so much for having me.
Thank you for accepting this invite.
Thank you.
Which is a very important one, I believe. And there are so many women out there who need your help and need the knowledge that you have and the experience that you have to be shared out loud for them to be aware, because I think no one is speaking about this. And it's extremely important for them, especially the mid-30s, early 30s. It's getting closer and closer to the 20s as well. Yes.
Yeah.
So, Dr. Tamara, you are most welcomed to BeHuman Podcast.
Thank you so much for having me.
Thank you very much. We're going to dive into, first of all, the most important topic, which for me, I just recently came to know about it. Obviously, I'm not a woman, so it's not my concern. But I do have women around me who I'm concerned about, and them being aware of what we're going to share. So perimenopause and menopause, we're going to dive into a few topics about these things. What is the difference between these two terms?
First off, thank you so much for bringing the topic of discussion. I know oftentimes women discuss it amongst themselves, but it's so important to open the table to have men also interested in learning about it. So I really hope that there are some men out there that are listening to this podcast. Don't switch off just because we're talking about women's health. Essentially, perimenopause and menopause are really simple to define. What's happened, I think, is the definitions have been used incorrectly, which has confused the public. So menopause is basically when your periods end. A year after that, you are classed as menopausal. So if you've not had a period for a year, you're menopausal. And the average age in the UK of menopause is 51. So around the age of 50, late 40s, we expect that women's periods will end. That's quite well known. Culturally, we understand that concept. What we don't understand is perimenopause. So perimenopause, by definition, is a woman who's having periods. And that's where people get tripped because they feel, I'm having periods, so nothing's wrong with me. Now, perimenopause, you can have symptoms. So the official thought process is that, my periods are going to end and I'm going to start sweating a lot in the night. But actually what happens is perimenopause occurs around 7, even 10 years before your periods end, and you can start getting symptoms at that point, even early 40s. So the average age of perimenopause is 47 in the UK. But in Asian, Arab women, we see that perimenopause and menopause occurs even younger.
Interesting. And what are these symptoms that you're talking about, like in the perimenopausal?
So this is where it's tricky because it's everything. So to understand why we get symptoms will help understand what the symptoms are. So estrogen is a hormone that all women have, and it's very, very important because of the fact that we have receptors all over the body, in our brain, in our bones, in our gut. So when our estrogen declines or becomes more erratic, as it does in perimenopause, because we have fewer eggs, fewer periods left in our life, what happens is these receptors start giving signs that, oh, I'm not being filled, there's not enough estrogen, and we get symptoms all over the body. And that's where doctors get confused, but patients do too. So hot flushes, we know that. Everyone's heard about it. But the more abstract ones are ear ringing, joint pain, lack of sleep, low motivation, poor sense of self, anxiety, low libido, gut problems, new allergies, oral health changes, hair fall, dry skin, you name it. I could give you a whole list. But it's a whole body change rather than just one thing.
Interesting. At what age does it start usually? Or what is known for perimenopause to start, and when women should be aware of that age? And is it getting younger and younger, like earlier?
So you should be aware that it's going to happen pretty much from, I would say, and maybe this is outrageous to say, but I think when we start getting our periods, we should be aware there's a finite time to them, and that at some point when we hit our 40s, we may start getting symptoms. So 1 in 4 women won't have any symptoms, but 3 in 4 will. That's a massive amount of women. So from the age of 40, it's just about being aware. But what's happening, what I'm noticing, is that women are being inundated with information about the symptoms once they're in the trenches. So you hit 40, you're getting symptoms of perimenopause where you're getting brain fog, overwhelm, low mood, and then you get a podcast or a doctor saying to you, oh, these are all the symptoms. Do you want to start HRT? And the woman is so overwhelmed because she hasn't ever thought about this before. I'll give you an analogy. In Mexico, they celebrate Day of the Dead. That allows death to be something that's part of a child's life, where it's not a shock to the system once it occurs in the family. They celebrate it. We need to start doing the same thing about women's health. I think we need to start discussing perimenopause and menopause with younger girls so that it's not a shock to the system when it occurs. So yes, 40 is the ideal age to be aware about it, but actually we should be having discussions within our family units from a young age, I think.
You mentioned HRT. What is HRT, if, by definition, simply?
Yeah, it's just hormone replacement therapy. So basically the hormones you're lacking, we put it back in.
Interesting. The hormones that you're talking about, what are these hormones that are included in the HRT? And is it just for women or is it just for men as well?
Yeah, so I primarily deal and focus more for women, but there is hormone replacement for men and women. So for men, it's testosterone. For women, it's estrogen, progesterone, and testosterone, because women make testosterone too.
True.
But
yeah.
Go ahead.
No. I want you to continue. But what are the most needed by the woman?
Estrogen, progesterone. So
Okay.
Primarily, I would say estrogen. We give progesterone, and this is what I talk through with my patients so they really understand what I'm giving and why. So let's just talk about menstrual cycles in general.
Okay.
So day 1, you're bleeding. Estrogen and progesterone are at its lowest. And you're bleeding because the estrogen and progesterone are at its lowest. After you bleed, you get ovulation, which is when women tend to feel amazing. And that is when your estrogen spikes. Okay. So estrogen is something that grows our uterine lining, and it's to help us get pregnant. The only reason we have periods is to basically have a pregnancy, essentially. So our uterine lining gets thicker with estrogen, and then progestation. So it's a hormone that wants to keep a pregnancy. What it does is it stabilizes the uterine lining. Now, why do we give those 2 hormones in HRT? The estrogen will get rid of your symptoms, majority of them. The progesterone has a calming effect on the brain, but actually the main reason that we give progesterone is to counteract the thickening that occurs when you give estrogen to a healthy uterus. So if I gave estrogen to every woman who has an intact uterus, what would happen is you would thicken it to the point where you could increase a risk of endometrial cancer, which is cancer of the inner lining of the womb. So we have to give progesterone to counteract that, to keep the uterine lining stable and thin.
Interesting.
So the testosterone, now that's a very, not controversial, but it's debatable amongst different doctors. Testosterone is solely as per UK guidance, solely used for low sexual desire. So in women who have low libido, There are studies that show that it reduces symptoms like brain fog, increases energy. If you think about men in general who have high testosterone, you're more alert, you're fitter, you gain muscle mass quicker. But right now, the main indication would be low libido.
Low libido, just for that. Okay. And how is it given? Injection or supplementation or any ointments or gels, or what's the safest?
So in Dubai, I'm very lucky that I can choose the safest option. And the safest option actually is gel, so transdermal or patches, which means it's absorbed by the skin. And that's talking about estrogen. The progesterone component is usually tablet or coil.
Okay.
You have options. The most important thing to be aware of as a woman is that you have options. There are alternatives. So there is tablet hormone replacement therapy for the estrogen side, but that has a slight increase of clots and strokes. When you take tablet estrogen, because it's metabolized by the liver, it increases your risk of clots and strokes. So I personally don't give it because I don't need to give it. I can give them gel. There's also injections in the US. There's implants. There's lots of options, but gel is my preference.
Talking about menopause, we're in 2025 and people still consider it as a taboo to talk about. From your experience, why?
I think it starts from childhood. I don't want to go too deep, but as a woman, from the get-go, you're taught, be very demure, be soft-spoken, don't bring too awareness of your body, don't be too aware of your body, it's rude. And then suddenly you get married and suddenly you're meant to be this vivacious goddess and bring life into the world, and you're not equipped with that because no one's even spoken to you about intimate things with your body. So culturally, I think we have so much work to do, and it's not just in the Middle East, even in the West. There's so much societal pressure on a woman to keep completely quiet. I think where it really starts is using accurate terminology of your body and knowing your body. So this is a segue. There is a condition called lactational atrophy. So lactational atrophy is where you breastfeed, and because the hormone to make milk inhibits estrogen, you temporarily get vaginal shrinking, basically. Shrinking of the tissue of the vulva, so you get dryness, you get sore, you get UTIs. And that's something that happens after giving birth when you're breastfeeding. How many women know about it? How many doctors know about it?
Okay.
I've spoken to so many people who have no idea that this can occur. They don't even have the language or the terminology to approach a doctor to say, actually, I've just given birth, it's been 6 months, and I'm getting back-to-back UTIs, and intercourse is really painful, and I don't know what to do. So what I tell everyone is, I will ask you, but don't be embarrassed to mention it. There are things that happen to our body that we don't understand. When you're in a room with me, you should feel completely safe to discuss whatever you want, however you want.
At the end of the day, this is your body and this is your life as well.
Exactly.
Your body means your life.
Exactly. And you have to advocate for it. But the only way you can advocate for it is by being confident about speaking about it.
Speaking about it to women, let's go back to menopause and perimenopause. Do you think that women should be educated at which age? And what age is it properly educating them about their menopause?
So doctors, we do 6 years of medical school and we have maybe one lecture on menopause, and it is basically the periods end, she might get hot flushes, and that's about it. I wouldn't expect the public to know more than that, but what I'm hoping is that things change the more that we talk about it. I would love for girls who are having periods who go to their doctor to discuss periods. Sometimes I get 13, 14-year-olds saying, I just want to talk about what my options are. That would be an opportunity to say, you know what, your periods are going to last maybe like 40, 50 years, and then there'll come a time where it ends. And that's it. We don't need to go further than that. Just that discussion, just a placeholder so that when they are a bit older, we can revisit it. I think it's not so much about overloading with information. It's just being able to even talk about it. I've had some Arab patients come in the room and they have a lot of symptoms, they're 55, and I'm saying, you know what, maybe this is menopause. No, please, don't mention that word. As if, you know how Arabs, we say like, don't bring life to the word.
Yeah.
Don't speak it out loud because the angels might hear.
Yes.
So we need to get rid of the fear. We don't need to lecture people or, you know, give them too much information, but we should be able to talk about it if the opportunity arises.
Interesting. Do you think that, because I deal with a lot of women, whether from family or clients or people that I know, and somehow because I'm training some of my clients and they ask me about training and stuff like that, so we get to open up a little bit, not to the level that they open up with you, but somehow. Some of the women are not aware, who are in their early 30s, mid 30s, late 30s, early 40s as well. They're not aware of the word or the term perimenopause.
Completely agree. Even doctors. I've had patients come in saying, I saw a doctor 5 years ago when my symptoms started and they told me you're having periods, so there's nothing wrong with you. By definition, perimenopause is a woman with symptoms having periods. So it's you know, it's such a shame. It's such a shame. Like some of my patients have been to 5 doctors. They've had symptoms for 6 years. So it's not just the public that are misinformed. It's a lot of doctors too. But I think the good thing is that we're having this discussion. 20 years ago, this probably wouldn't have happened.
True.
It's the first step is just opening up the dialogue. There'll be men hopefully watching this podcast who will start linking 2 and 2 together. Like, oh, BBT, my grandmother, you know, when she had that mental breakdown at 55, maybe she was actually struggling with menopause.
Yeah.
In hindsight, you look back, I get some patients saying, if it's a natural thing, what's so bad about it?
Absolutely, yeah.
Childbirth is a natural thing. And before modern medicine, women died all the time. So yes, okay, it's natural. And 1 in 4 women won't need any input from me. But their best friend might be the 3 and 4 that's struggling. You are a man, you won't go through it. But by definition, 100% of women will experience it. So you will be affected.
True.
Everyone listening to this will be affected. Sorry for tapping the mic. But I need to stop using my hands as well.
No. Go. It's safe to talk and touch, yeah.
Good.
I had a follow-up question regarding this topic about perimenopause before going. If you would want to list the top symptoms that women are not aware of, but it's caused because of the phase of perimenopause, and when does perimenopause start before it's menopause time?
Perimenopause can happen up to 10 years before your periods end. Long time before.
That's
you can start.
Long time.
Yeah, you can start getting symptoms in your early 40s. In terms of odd symptoms, I guess, you know, things like joint pain. A lot of times women will go to an orthopedic surgeon or a rheumatologist. They think they have arthritis. The doctor says there's nothing wrong. They leave the room thinking, well, my hands hurt and my shoulder hurts and I'm getting more injuries even though I'm weightlifting. What's going on? I've never had this problem. The other more abstract things is about your pelvic floor. So your pelvic floor relies heavily on estrogen. It loves estrogen. Over our lifetimes, we exert a lot of pressure on our pelvic floor day to day. And when our pelvic floor doesn't have estrogen, when the bladder and vagina lack in estrogen, you can get awful symptoms. So UTIs is one thing. So I get women in their 60s getting back-to-back UTIs, living on antibiotics, when actually all they needed was a bit of vaginal estrogen. Completely safe.
UTI, can we explain a little bit the definition of UTI? What is UTI?
Yes, so UTI is a urinary tract infection. So it's an infection of the bladder that causes burning pain or feeling like you haven't emptied properly. And it can be really debilitating because antibiotics on their own, they have loads of side effects. And at some point, if we use them too often without fully needing to, you can get resistant. So we have something really basic, vaginal estrogen, which I haven't spoken about. Vaginal estrogen is a type of hormone replacement, but it's beautiful in the fact that it doesn't go around the body. So in women who've had breast cancer, even women who've had breast cancer can have vaginal estrogen. Okay. Women who are breastfeeding can have vaginal estrogen. And it can really get back the tone in the pelvic floor. It can reduce symptoms of vaginal dryness, pain on intercourse, reduce UTIs. It's a wonder drug. Further than that, there's also symptoms that women can't put their finger on. So I get a lot of women coming in saying, I don't know what's wrong with me. I just don't feel myself anymore. I don't want to hang out with my friends. I don't want my husband to be near me. I've had a couple of patients who are leaders in their role, CEOs, who say, I can't even public speak. I never had a problem with it. So these things, what doctor do you go to for that? Who do you speak to for that? Women,
psychologist probably.
Women struggle to know what is wrong.
Apart from this, what else would the symptoms be that women are not aware of? Like the mood swings, probably. I've heard that also, like some issues between the husband and wife starts raising up. Most of the divorces are happening around this 10 years of perimenopause.
Yeah. So there was a survey in the UK in 2016, and it found that women were shocked at the extent of how much their home life was affected by the perimenopause journey. 50% of women said it directly impacted their relationship. Now, when we talk about relationships, we're talking about a really complex thing. It's not something that you can say, I'm going to put this hormone in and it will fix my marital relationship. But what we definitely know is that because of a reduction in estrogen and progesterone, your body will be affected to the extent where you can suffer with low libido, pain on intercourse, dryness vaginally. These are things that women are really embarrassed to discuss. They just grin and bear it. The problem with grinning and bearing it is it makes the situation worse. And if you don't have the language to explain what you're going through, your spouse also won't understand. So they'll start thinking, we've had 20 years of a great marriage and now you don't want to be around me. What's really important is just being aware that it can occur. It may not. You may be lucky and things may be great. 50% of women will have no effect or impact on their relationships. But for the 50% that do, there is opportunities for us to try and help you. And I talk about vaginal estrogen with every patient, but it is really a wonder drug.
Interesting. I believe men and women should understand this phase that they go through, because I have witnessed a lot of people who went through this. But the thing is, some of them are not aware of it, and they consider it like as, again, a taboo to even mention this from the spouse to the wife, saying like, listen, maybe it's this. If the husband is aware, can we have you treated? And she gets super defensive, escalated the mood, and then they end up just separating. So I think the importance of this podcast is to spread this awareness for women, to listen from a woman and be aware of her own body, to help herself, help her life, and help her marriage as well. So how important is hormonal health for women? It definitely is. One of the main factors could be stress. Does that affect?
Massively. So periods in general, fertility in general, is not a priority for our body. It's a bonus. So orthorexia, which is over-exercising, anorexia, which is under-eating, certain vaccines, illnesses, you'll notice that in these stressful periods where a woman's body is under strain, her periods will disappear. Why is that? It's because of the fact that there is a link between cortisol and estrogen and progesterone. And I don't know if you said the word hormonal balance, did you?
I did, yes.
So I don't like that term. Only because when you envisage it, you think of, I need to get this
much of this, and
the scale has to be like this. If you look at the menstrual cycle, it's a flux. So I like to think of it as the hormonal flux. It's a state of change. We are miracles in the sense that once a month, everything changes. So in terms of stress definitely impacts our hormonal health. The problem is that women are vulnerable. So you're getting a lot of companies who are marketing, take this and we will get rid of your, I've heard terms like estrogen dominance, cortisol dominance, copper overload, detox this, do this. Khalas, like at the end of the day, from the beginning of time, we used to live in caves where we were exposed to leprosy and TB and God knows what else. We had awful things happening to us and we would die really young. Now, yes, okay, we have a lot of stress in our lives, but we're also living longer. So we have more evidence to show that certain things affect our body. But it doesn't mean that we need to live in a cage. And, you know, I get some people who are doing oxygen therapy because they're worried about
their oxygen levels in their blood or whatever.
Yeah, like it gets to a point where it's like, it's almost like we're producing a generation of people who are afraid to live.
Yes.
We need to live our lives. You should do it the way that you prefer. My job is to support you alongside that. So I'm never trying to convince people to change much apart from things that I know are really wrong, like smoking and drinking and poor diets and lack of exercise.
Yeah. Going back to exercise, I want to just tap on what you just said earlier, is overtraining and training for women. Like most of the people are aware, especially women are aware that training is important, and they go to the gym and they do their best to train. So is there any difference between men training and women training from your perspective?
Massive.
Okay.
I'm not an expert. I feel like you're more of an expert than I am, but
medically, let's say, like how does it affect the hormones in a woman? Yes.
Yeah, because our our metabolism is changing throughout the month. So men as static beings are very lucky that nothing much will change throughout the month. For us, it's completely different. In our luteal phase, progesterone causes so many things like bloating, breast tenderness. Even if you look at a woman in the luteal phase, you'll notice a difference. And actually, interestingly, estrogen is 3 times its amount in your lifetime in your 3rd trimester of pregnancy. So that term, oh, the woman is glowing, it's because she's got a lot of estrogen. Yeah. So luteal phase, there's basically no estrogen. Training in
luteal phase is directly after the end of the first cycle.
Yeah. So day 1 is when you're bleeding. Average woman bleeds 7 days. Day 15 would be when you ovulate, you feel great. That's when women like to train. And then the last 2 weeks before your period comes is luteal phase.
Okay.
So the week before your period's coming, a couple of days before, you might even feel crampy. And it's just not the time really to do heavy lifting. Some women find that it eases menstrual pain, which is fantastic. But I think as women, we need to be kinder to ourselves because it's not a balance, it's a flux. We are constantly changing day in, day out. So not to segue, but I think over-exercising, is really damaging for women because our metabolism is changing. So we can't just do static exercises the same way throughout the month. Likewise with our diet, we should be loading up on protein when we're in our menstrual period because we're losing a lot of blood.
True.
Well, not a lot of blood, but we're losing blood.
Yes. Yeah, and then this is happening every time, and
Every
there's no
month.
reload of
No.
Talking about diet, intermittent fasting.
Listen, I don't know if you've seen pictures before or after of me. I'm a big fan of intermittent fasting.
Okay.
Mainly because at the time when I did it in 2022, there was a lot of evidence that seemed really convincing, amazing. You know, the idea that you can eat what you want, but give your organ, your pancreas, a bit of a break to say, you don't have to make this much insulin. Let's just have a bit of a gap so it can work effectively. It's quite nice. It makes sense medically. Okay, I'm going to get my organs to work in this window, and then I'll have a period of time where I relax a bit. And I lost 30 kg on intermittent fasting after I gave birth to my son. I didn't change anything about my life. So I'm a testament to it working, but it's dedication. Okay. It's hard. It's not an easy thing. And I'm going to be honest. I don't believe in bad food. I just believe in bad diets. So anything that's going to be taken to an excess is unhealthy. It needs to work with your lifestyle. It needs to be easy for you because then it's maintainable. Then you can do it lifelong. Crash dieting is never the way. It's never going to work.
Maybe you're going to change your way of thinking of what you just said.
I'm sure I will.
After what we spoke before the podcast about the other thing.
I'm going to try carnivore diet. Yeah.
And then we will have another talk about this probably. But my question was like for the intermittent fasting, does it stress a woman? Does it harm her hormones? Because there's a lot of talks about this, saying that women should not be doing it.
I think everything in moderation. If you are a woman, no two women are the same. You have women with endometriosis. You have women, and endometriosis, if you don't know, let's take a moment to explain.
Yes.
Endometriosis is extremely painful periods that affects your quality of life. It's not normal. And if you're a woman who's on the first day of bleeding, vomiting or collapsing, please go and see a gynecologist, because endometriosis is really, really damaging. Now, going back to what we were saying, no two women are the same. So one woman will have really light periods, 2 days of bleeding, and feel amazing throughout it. That woman could sail through intermittent fasting. There'll be women who have endometriosis. I mean, you have to put it into context of the person and their baseline, what they do on their baseline. So for me, intermittent fasting was easy. As a doctor, I never had breakfast.
Okay.
I never had time to have breakfast. So without knowing, I was always intermittent fasting. But for someone who has a maid who's cooking breakfast for them and then suddenly skipping that, it might be a massive strain on the body. So metabolically, you need, as women, to take a bit of a breather in the luteal phase, in the phase when you're bleeding.
Bleeding. Okay.
Bleeding. You need to take a bit of a break, no matter what you're doing, whether it's exercise or diet. So chocolate.
Why is this craving? Why is this craving happening? Like just during this phase of the men?
Part of it is because of the hormonal flux. Part of it is also just we really feel rubbish, and the kick of endorphins that you get when you have something you like is just makes it a bit easier. Okay. So it's as simple as that, really. There isn't that I know, there isn't like any studies that prove that there's this chemical that's released or anything like that. It's just bare basics of life sucks when you're on your period. Give us one thing to enjoy.
Interesting. You mentioned also earlier that the period duration in an average woman is 6 to 7 days.
On average, 7 days.
7 days. I've heard something that, correct me if I'm wrong, that previously our, let's say, ancestors or after that, it shouldn't be lasting more than 3 days, 3 to 4 days. It's just getting longer and longer. I don't know the truth or the science based on that, but...
I don't know that there's any evidence to that. Again, I don't know how we'd collect that evidence. So maybe potentially it could have been the case. There's no ill health that comes from having a shorter period. So a lot of women come to me and they say, my periods, the cycles are getting longer. I used to bleed once a month and now it's once every 31 days. Everyone it's okay to have a variation. So 3 days, 7 days, it doesn't really matter. It doesn't signify your health. What I would say is that the biggest thing is we're living longer and our quality of life is so much more. If I existed 500 years ago, I don't know what I'd be doing. My quality of life would not be the expectation that I'm going to live to 80 and golf with my friends. It would be very, very different, working in a farm till the age of 12 when I would pass away from a natural disease. So a lot of the reasons why we're seeing more and more diseases, I think, okay, partly is our lifestyles, yes. But a bigger part of that is we're just living longer and we're demanding a better quality of life.
Okay, interesting. PCOS. I hear this a lot from women and also thyroid issues. It's not just PCOS. Is it related to hormonal problems in women?
Yeah, so there's PCO and there's PCOS.
Okay.
PCO is polycystic ovaries. So you scan a lady, a gynecologist will scan a lady and see lots of cysts on the ovaries. That in itself chops and changes. So the month after you might scan her and she doesn't have that many cysts. PCOS is polycystic ovarian syndrome. The syndrome is a hormonal imbalance by definition. So that affects your metabolism, it affects insulin resistance, it affects weight, it affects fertility in some unfortunate cases. And that is definitely a hormonal imbalance. With anything in terms of women's health, the first step is knowing that something's off and going to seek an expert opinion, seeing a doctor, because there's so many TikToks right now saying, PCOS, let me heal it naturally with this breath work, and let me go in this cold plunge and I'll balance my hormones, balancing hormones. No such thing.
I'm not going to use this word after
No, you can. I understand
but
it.
you made it clear why.
Yeah,
yes.
the marketing around
especially,
it is
especially for women.
Yes.
Yes.
Yeah, because no such thing. Internationally, there's no parameter. This is another thing. A lot of women say, my estrogen levels are low. I had a blood test and my progesterone levels are low. There is no agreement amongst the world that below 60 estrogen level is dangerous, because by definition, it's going up and down throughout the month. For polycystic ovaries, we have to time the blood test to diagnose it between day 2 and 6 of your period so that we get probable cause. So there are certain conditions where we have to time it to your period to get a level. But in terms of perimenopause, we don't do blood tests to check hormone levels.
Interesting. Now, let's shift to mental health and women. Anxiety and depression, are hormonal or psychological?
Yeah, both. So both, yeah. So we'll start with hormonal first, because that's what you mentioned first. So hormonally, when estrogen is low, there is a link between estrogen and serotonin, which is our endorphin, our happy hormone.
Yeah.
So when estrogen is low, serotonin dips too. Now, estrogen is lowest right before our period comes. So a lot of women will say, or their spouses will say, oh, she turns into a crazy lady before her period or first day of her period.
Yeah.
This is actually not normal.
Okay.
So we as women should not notice a change in our mood before our period comes. We shouldn't know, my period's coming, I feel off. That in itself is premenstrual syndrome, PMS, and the very severe version, PMDD, which is dysphoric disorder, where you feel the symptoms so severe that your quality of life is affected, you can't go to work. That's actually an illness. It's something that you need to see your doctor about. We joke about it,
Sure.
but it's debilitating. 3-4 days of the month where you're raging and tearful and not feeling yourself is not the way someone should live. So in that effect, yes, there is a link between anxiety and depression and hormones. So in a woman who once a month, like clockwork, she knows when her period's coming because her mood has changed, that is hormonal. The alternative is that you just have anxiety and depression, not linked to hormones. That can occur too. The easiest way to know the difference is by knowing your cycle, understanding the luteal phase.
Okay. And how does that work?
So, like I said, the bleeding on day 1 is the beginning of your period cycle.
Yes. Now, what is it that they need to check and see during that luteal phase?
Just on a lot of women now, I'm really happy they have apps, like I won't name them.
Yes.
They have apps to track periods, and on that you can log your mood.
Yes.
So I really like it when women come and say, I've logged my period for 6 months, and 2 days before my period comes, every single time I'm tearful for 2 days and I don't know why, and I don't want to go out, I don't want to hang out with anyone. That has already told me, okay, you have PMS. She's done the groundwork. She's logged and documented that cyclical change for me. So I really like it when women are attentive to their bodies and start.
Okay, interesting. Now you got my interest here. I'm going to open up as well for our relationship, me and my wife. There are days that we joke about, me and my wife, but now that you've mentioned this could be something hormonal, is I know when her periods are coming because I know when she's going to have, like, I'm not tracking, but I know, like, there's another person that's going to come out of her that I rather run away from, avoid any conflict. Because I have certain tolerance to some behavior.
Yes.
So better for me to step out. So is this normal?
No, it's not normal. No. And it's something that, we should as women seek help for. Oftentimes women are embarrassed, or it's a bit too normalized in society that, I'm PMSing. But if it's getting to the point that it's affecting relationships, there are simple things like vitamin B6. It's not a tablet that you need to get prescribed from your doctor. It's a vitamin that you can take, and studies have shown that it's effective in symptoms of PMS. So there are simple steps, but also just recognizing. So already you've kind of recognized that this occurs, but she may not be aware. So having that discussion sensitively it doesn't mean that we're crazy. I think a lot of the discussion around hormonal women and things like that, there's this perception amongst society that having a hormonal change is weak. You know, a lot of derogatory words about weakness is female anatomy, but actually, if you think about it, the stuff that we do as women, we're the strongest people alive.
Absolutely.
Like
Absolutely.
even just
You're superhuman beings, because even like your recovery is fast, your capability of healing and
exactly,
yeah.
and we can function while bleeding. There's so many things that we do that are impressive if you take a step back.
Yeah.
So my whole point is that as women, we should be able to lean into saying it's not a weakness. This is something that's abnormal, and I'm going to try and fix it.
Yeah. So what are the things that you recommend these women who have these issues with the mood swings?
First thing, diarize it. So I want you to, not obsessively, but if you have an app that's tracking your cycles, if you're noticing dips in your mood, anxiety, anything like that, just track it on your phone.
Okay.
Then you'll start to have objective proof that actually this is occurring only in the week before my period comes. Step 2, go see a doctor.
Okay.
So step 2 is talk to us. Now, doctors are humans too. So this is in every career path. There's a reason why you do what you do, and it's because you've been affected by something that's touched you, that's made you feel like I need to become this because this impressed me, or I went through this and I wish I had this version of me in front of me.
People, yes.
Exactly. So me specifically, I nearly died in childbirth. I was gaslit by lots of medical professionals, a lot of them being women who told me that the things that I was experiencing were psychological, that it was all in my mind. Because of that, I then became almost not obsessive, but I became hyper aware that, oh my gosh, I'm a woman, this is going to happen to me. 100% I'm going to become menopausal. If I don't know everything about PMS, who does?
Yeah.
But there's a lot of us as doctors that don't know that much about it. So my second thing is advocate for yourself. If you as a woman, you go into a room with a question and you walk out feeling it wasn't answered or explained, either go back in,
Okay.
force yourself back in, or see someone else.
See someone else, yeah. Perimenopause is mistaken for mental health disease.
Mm-hmm.
What's your intake about that?
Yeah, 100%. 100%. I see so many women who have been started on antidepressants. And actually, when you take a step back, and so my speciality, I don't think I mentioned this, my speciality is family medicine.
Yes.
So we look at a broad overview of everything. We're not an expert in anything, but we're a master of a bit of everything. So they might have gone to see a psychiatrist because they were feeling really low. That psychiatrist starts them on therapy and antidepressants. But then looking back, actually she had poor sleep, low libido, brain fog. She had night sweats, hot flushes, joint pains. And then you look at it and you think, okay, the antidepressants will treat the symptom. It will help with the symptoms. But she could have had a discussion or the option of HRT. It's not that one is superior to the other, because that is dependent on you as a person. The person in front of me decides what's superior for them. But to give the option to open the discussion is what should be done.
Interesting. You mentioned medicine and in general, like compared to lifestyle, which one would you prefer, or can they go both hand in hand together sometimes?
Yes, definitely. The analogy I read somewhere, and I use it with all of my patients now, is you cut yourself, okay? You cut yourself, so you're going to grab a plaster just to stem the bleeding. So the antidepressant is just the plaster, so it's immediate relief, okay? That will get you up and out so that you can get in the car, and make your way to the doctor. The therapy is where the real work is. It's where the stitching happens to fix the wound. So antidepressants just help people get to the appointments. Yeah, they help them get that relief. And there's a lot of, again, mental health and women's health are both underfunded and poorly understood. Antidepressants are not toxic chemicals. They're not scary. A lot of people think, I don't want to take that. I'm going to become a zombie. They're going to change my personality. If you understand how antidepressant works, it makes you a lot less fearful. And actually, our brain makes, I've already said, serotonin. So we have a happy chemical that's flooding our brain, and then our brain recycles it. And let's say it recycles it really fast. So you have that happy feeling, that neurotransmitter that makes you feel good, and then it goes. What antidepressants do is it doesn't add in chemicals or change anything. It does change things, but what it does is it blocks the recycling. So the serotonin that your body made, it just lasts a bit longer. So what we're doing is we're not making you into an insanely happy person. We're not changing your life. We're just letting you be a bit more stable so that the therapy can do the real groundwork. And I'm a big believer in therapy. I think everyone should, at some point in their life, see a therapist.
See a therapist,
Yeah.
There's no harm in that as well. One question, like, what would you want women to know before visiting a doctor?
First thing is that we're human, that we have been patients before. So when I see a woman in front of me, I imagine them as me. So I know it's hard to trust doctors sometimes if you've had bad experiences, but try and understand that we're humans too, and our main aim is just to keep you safe and happy. The second thing is advocate for yourself. If you feel, like I said, if you walk into a room with a question and you leave it with no answers, just, I couldn't find anything wrong, goodbye.
Yeah.
You need to keep going. Keep advocating for yourself. I know sometimes it gets exhausting and people feel very poorly misunderstood by modern medicine, but there are doctors out there that we really are continually learning new things. We're continually trying to keep abreast of all the new information that's out there, because medicine is evolving. So those are the two things I would say. Advocate for yourself and remember that we are humans too.
I'm going to fire you with some nice, quick questions, and I need your intake about HRT. Yes or no?
Yes. Yes to women who are struggling with symptoms.
Okay.
So if you are menopausal but you have no symptoms, you don't need it.
Okay. So again, this is for women who are in their perimenopausal. So where's the triggering sign that they need?
Your symptoms.
Yes.
Your symptoms.
Okay.
That's it. It's not an age
or
a blood test. It's
what's the the youngest that you've seen who had a perimenopausal symptom and you needed to treat her?
Well, I'm sure.
Or what does the data say? Sorry to interrupt.
Yeah, no, don't worry.
Yeah.
I mean, statistically 40, that kind of thing. But I am seeing women who are late 30s who I'm thinking in my head, this is odd. This is a lot of symptoms of perimenopause. And the problem with perimenopause, or why doctors struggle, is there's no blood test. There's no laboratory investigation that you can do and say, this is perimenopause. So it takes a skilled doctor, someone who's actually
experienced.
Yes, exactly. But yeah, I'm seeing women in their early 40s, 41, 42.
Interesting. Coffee on an empty stomach.
You know, I don't drink coffee or tea, so I'm the wrong person to ask. I personally feel that coffee on an empty stomach increases gastric upset. So things like reflux, bowel motions, things like that. So I would prefer that people have it with food, alongside food.
Let's talk about just women here. I see a lot of women lately, like there's a huge addiction to coffee.
Yeah.
And they wake up first thing in the morning, where's my coffee?
Yeah.
If she cannot talk, or you cannot talk to her if she doesn't have her mug or cup in her hand. So does that affect her body? Does it increase any hormone?
Definitely. So in general, palpitations is a symptom that can occur because of perimenopause. You have coffee on an empty stomach, you might get palpitations. It increases your resting heart rate. So there are evidence and studies that show that caffeine is beneficial.
Yes.
So I will step aside and admit, although I don't drink coffee, there are some benefits apparently, but I wouldn't recommend on an empty stomach, no.
Okay. Birth control and hormonal balance. Smart or risky?
Birth control has saved us from dying in childbirth unnecessarily. So birth control has to exist for us to have autonomy. Now, should all men have vasectomies? Absolutely. But that's a completely different topic. And one that, it will probably take 50 years. Maybe when I'm 80, the society will have changed a bit where we're getting more men having vasectomies. We need birth control. We need to be able to control when we plan our family. Women are having careers. We're not able to take 7 years of mat leave and have financial stability. So yes, birth control is great. For hormonal balancing, though, it really depends. So this is a whole topic on its own. Endometriosis, for example, every time you have a period, you're bleeding into your abdomen. So your stomach, that's not meant to have any blood in it, you will literally bleed into it. And that will be agonizing. It'll be the worst pain that you've ever experienced. How can we control that or reduce symptoms? Unfortunately, one of them is birth control. Okay. So if we stop you having periods for a period of time, you won't get the bleeding.
You said unfortunately.
Unfortunately, because why is vasectomy superior? Because there are risks with birth control. So we skipped a bit about HRT, about the risks of HRT. So one of the risks is breast cancer. It's a tiny risk, but it is a risk. Now, you get the exact same risk of breast cancer with birth control, with specific types of birth control, but you can get that same risk. But women aren't counseled when they come for their refill of birth control that you might get breast cancer. We're not aware of the risk. So birth control in general is fantastic. It's necessary. I will never, ever stand here and say, it's dangerous, don't do it. It's necessary. Are there better options for us? Yes, vasectomy. But that will be a completely different podcast episode, and I'm sure men in the comments are going to be blocking you.
Interesting, yeah. Mental health meds and or mindset first.
It really depends on how deep you are into the depression. So I've met people with depression who don't speak. As part of my training, I did 6 months in a psychiatric inpatient unit, and you get people who actually can't even shower. They can't get out of bed. Therapy is not going to work for them. You need to get them to the point where they're functioning in society to get to the appointment for therapy. So again, we need to put it in context, but I think it's a combination of both when needed. And HRT and antidepressants, actually, they live in a very similar world because there's no blood test to tell you that you're going through perimenopause. There's no blood test to say that you're depressed. But it's the decision of the person opposite me. All I can do is arm them with the equipment to make the decision. That's really it.
Is there a period of time to use HRT, like the duration of it?
We want you to start it, if you want it, within the first 10 years of your period's ending, because evidence shows that after, so say for example, you're 70, and now you're reading about all of the studies on HRT and you're like, I'm interested, I want to start it. If you start it after 10 years of your period's ending, you have an increased risk of like a stroke or a heart attack happening. So we try and avoid it after 10 years. But in the first 10 years, there's lots of benefits.
Okay.
Likewise, the length of time, so the average length of time that a woman will have symptoms of perimenopause or menopause is 4 to 8 years. So a lot of women will be on it for 10 years. Once a year, we have the discussion of how are you feeling? Do you want to stop it? It does not change the course of your journey with menopause. So you being on HRT, you will still end your periods when you're meant to. You have a finite amount of eggs. They're going to finish at some point. So at the end of the day, you can choose to stop it tomorrow. And your symptoms will come back if they're meant to, or they will not be there if you've passed through it. There's only the only way of knowing is by trial and error.
Okay. And HRT is for perimenopause and menopausal women.
It's based on symptoms. Whenever the symptoms come.
Okay.
Exactly.
Interesting. Food and diet for hormonal health. What is your take about this?
In general, like I said, periods are a bonus for our bodies. It's not a necessity to be fertile. Our body will prioritize other functions before it prioritizes our fertility. And periods are just about having a baby. So what you put in your body is what you get out of it, 100%. No two ways about it. So if you are starving, for example, you'll see malnourished women will not have periods. They will not be able to fall pregnant. The most important thing that I tell all women is prioritize protein. Not enough women are eating enough protein. If you show them how many grams they're meant to have a day, they're always shocked. The second thing is about empty calories. So a lot of women will be having juices, they'll be having alcohol, no nutritional value to them.
Sure.
They don't count it as calories because it's a quick drink, but actually the weight gain, and this is a separate topic, not to take too much of your time, there was a SWAN study which showed that an average of 1 kg, 1.5 kg per year of the lead up to menopause, which could be 8 years, 1.5 kg weight gain through no fault of their own, because estrogen governs how women lay down fat. So when our estrogen drops, we start laying down fat how men would. So we'll get central, a belly. And these things could be affected by your diet and your lifestyle. Every woman should weight train. I've never been to the gym in my life until I started doing what I do. And now I obsessively go to the gym because I can see that actually women who exercise, these 40 and 50-year-olds that have been exercising for years, their symptoms are a lot less. Their quality of life is a lot better. Why would you not want to invest in your body? You get what you put in.
So exercise helps boost your hormones that are meant to give you the happiness and this.
Yeah, you get endorphins, but not only that. If you break your hip as a woman, you are massively at risk of dying in the next 5 years after breaking your hip. Why do women break their hips? Because their bones become soft. Osteoporosis. And how can we prevent that? If you don't want HRT, for example, or tablets being given to you by doctors, weight training. Physical training. Yeah.
It's interesting here. The food balance compared to the exercise and how important it is for a woman to do the exercises. I didn't see that coming, to be honest, from you. Yeah.
Really?
Yeah, since you've been talking about overtraining a while ago. We were talking about that, and now you're pushing women to do the training. Is there a certain age or a certain limit of training that would be beneficial? And do you train throughout the month, or there are times where you stop?
There are times when I advise, and there are times when I stop, for sure. Yeah. Age, I think it really depends. So people who are childhood athletes, for example, they push their bodies to the point of exhaustion. So a lot of athletes, I'm talking marathon runners, endurance trainers, high intensity trainers, they will notice the absence of their periods. And as soon as they stop training for the Olympics, their periods come back. That's quite common. None of us are Olympic athletes. Maybe you are. I'm definitely not. So essentially, we're talking about people who train maybe 3 times a week. That's the sweet spot, in my opinion. 3 times a week, doing something that you love. There is no point slotting yourself into a pocket that doesn't fit. So I always say to women, find movement that you like. I don't care what it is. I would love for you to weight train. But if you going to the gym fills you with anxiety, then you're not going to do it. You might do it for a week or a month. That's not what I want. I want you to do a movement that you like. So for some women, it's swimming. For some women, it's Pilates. Pilates is fantastic for our core. Yeah. For some women, it's strength training. For me, it's strength training. It's what I've enjoyed. Movement, just keep moving.
I want to go back to what you mentioned here, that what's the percentage again of women who gain weight, fat, is due to hormonal?
So the study was based on looking at women and their average weight gain per year in the lead up to menopause. So let's say a woman is 51 and she becomes menopausal, but she started perimenopause at 47. Okay. So that's 4 years where she'll gain 1.5 kg on average per year, even with exercising and good diet, because of the fact that estrogen is reducing and it governs the way that our metabolism works. It governs the way we lay down fat as well. Okay. So a lot of women, you'll notice, they don't look like they did in their 20s, and it'll be harder for them to lose the fat around their abdomen because of the hormones reducing.
Interesting.
But we just need to work harder and smarter. So if you don't use it, you lose it. I'm going to talk about Lindsay Lohan. Lindsay Lohan looks amazing right now. Her dermatologist, plastic surgeon, whoever she's using is amazing. But at the end of the day, we all age. Yeah. I will not be able to say to you that you will retain the muscle mass that you had in your 20s, in your 50s. You need to put in the work. There's no tablet or there's no injection. There's nothing that can keep you strong. Yes, I can make you slimmer, but we don't want women to be slimmer. We want them to be strong.
Thank you very much.
Yeah, and this is what I always talk about with my patients. They say, I'm so self-conscious. I've got, I feel bloated around my stomach. I'm embarrassed. I don't feel confident in my body anymore. I'm like, okay, you may not feel confident in your body anymore, but can you stand up from the floor without assistance? Sure. Can you run with your children? Can you do these things that we take for granted in our body? Actually, our body is being so kind to us every day. We need to be a bit kinder. but we also need to put in the effort to maintain our muscle mass, because muscle mass governs our metabolism.
Absolutely.
The more muscle you have, the faster your metabolism.
Absolutely, yeah.
And women get surprised when they've not worked out ever and they say, I'm gaining so much weight rapidly. Then I have to explain, actually, it's because your muscle mass is quite low.
Yeah.
So we need to start with training.
Training, yeah. There are women who are having a bit of higher percentage of fat. I don't like to call them fat women, but I would just respect that they have higher percentages of fat in their body. They say or claim that is, my hormones are all over the place. It's a hormonal issue. It's not an eating habit. How does that, and they're younger, let's say, not even close to perimenopause. They're in their 20s, some of them. They're in their early 30s, mid 30s as well.
There are definitely endocrinological disorders that can affect weight distribution. So women with PCOS, for example, unfortunately, they'll have very skinny legs and most of their weight will be around their stomach. Likewise, hypothyroidism, which is when your thyroid is underactive, your metabolism will slow down, you'll gain weight. So there are definitely disorders. And I should have said this at the beginning. Any woman who comes to me saying, I think I'm perimenopausal, I have all these symptoms, I always check their bloods to make sure that I'm not misdiagnosing them with perimenopause when they actually have a thyroid disorder, for example. So there are 20-year-olds around that you won't know, but they will be struggling with PCOS or struggling with hypothyroidism or even depression. And that is why they are where they are. And I think, again, going back to it, I don't want slim women, I want strong women. I want you to be able to flip your child in the air and run after them. I want you to be 80 and be able to get up off the floor on your own. That is things that I wish for myself, and that's what I'd wish for you or anyone listening as well.
Absolutely, yeah. Worst advice you've ever heard given to a woman?
I'm going to get out my file.
I
have
a lot.
So many. Number one, this estrogen dominance thing that everyone's talking about. I get 30-year-old women saying, I think I have estrogen dominance. What does that mean?
Okay.
What does that mean? Like, we're women in a state of flux. At any given time, we'll have more estrogen than we will at another time. So that's not a thing. Second thing, women coming in saying, I went to a doctor and they said, I'm not perimenopausal because I'm having periods. I'm sure we've established now, and anyone listening will know that you can have symptoms with periods and it is perimenopause and you're entitled to options.
Okay.
Third thing, blood testing. So I had a blood test to check how much hormone I need, as if we're a slot machine that says put 10p in and you'll get a toy. That's not the way our body works. We're not titrating your body by a number and saying you need to put this much testosterone in to get this feeling, because your testosterone could be lower than mine.
True.
It's irrelevant. If you feel good and I feel good, who cares? So we're not slotting in hormones to make you feel good. It's about your symptoms. I've had women say that I was told to stop my HRT when I'm bleeding. Like, they stop the estrogen gel when they're bleeding.
These are myths.
All myths.
Yeah.
Too many to count, in all honesty. So much misinformation.
But you highlighted the most important ones that came out of you straight away, because that's how much...
It makes me sad. It makes me really sad, because it's just very telling that we do so much. We are, as doctors, we're very privileged. We see you at your most vulnerable and we are there to assist you. But women's health is not a big thing that's taught to us as doctors. It's really not. I mean, if you ask any male colleague for certain definitions about menopause, a lot of them will be like, let me think about it. Through no fault of their own. It's just the way that our curriculum works.
What message would you give to every woman listening who feels something is wrong but doesn't feel heard?
Keep knocking on the door till one opens. Keep advocating for yourself. Keep going. Don't lose hope. There is always going to be a solution to everything. And it might not be a medication. Sometimes people leave my room feeling a bit deflated because they were expecting me to give them loads of medications and blood tests and tell them, this is what's wrong with you, take this tablet. Actually, my job is to make you feel listened to, heard, and to give you the information to understand your body better. Further than that is just extra things. So the medication is extra tools I have, the investigation's extra tools I have. But the first key thing about why I do what I do is for you to feel understood and heard. Yeah. That's really all it is. So if you don't feel that way, keep looking, keep going.
Interesting. Dr. Tamara, thank you very much.
Thank you so much for having me. Inshallah, this will be helpful to some.
It's definitely, to me, now I understand that I need to have a word with my wife. To have her visit you, just to say hi. Yeah, yes. Just to say hi, to introduce you, to get to know how things can be improved if needed. Yeah. I hope not.
Inshallah.
Yeah. But really, it's been very interesting topics that we covered today. And I learned a lot from my side as a man, which I advise all the men also to listen to this podcast because it's very important for them to know, to help and understand that things sometimes happen. It's not deliberate. It's not because you've done something wrong. We're okay sometimes.
But sometimes you have.
Sometimes we do. We do have our moments, yes, but it's not all the time.
No, definitely.
But just pay attention, and also for the women as well. I think they need to be educated both.
Definitely, and doctors too. I'm sure there'll be doctors listening to this podcast maybe that might have found something interesting, so I hope it helps.
Yeah. Don't stop reading for the doctors. Don't stop searching.
Never. Even me.
Yes. Interesting. Thank you very much again,
Thank you
Doctor.
so much. Thank you.